The quality management system and its process requires an organization to maintain document information to the extent necessary to support the operation of the process and retain document information to the extent necessary to have a confidence that the process are being carried out as planned. The quality management system of GRS establish the procedure and the responsibilities for all processes developed from the company's mission statement which have an influence on the quality of the services and the products. This ensures a sustainable principle. Good documentation constitutes an essential part of the quality assurance and is a key to operating in compliance with GMP requirements in QMS. Documentation may exist in a variety of forms, including paper-based, electronic, or photographic media. Objective of the system of documentation utilized must be established, control, monitor, and record all the activities which directly or indirectly impact on all aspects of the quality of the medicinal products. There are two primary types of documentation used to manage and record the GMP compliance instruction and records. Required GMP documentation instruction type 1 specification describe the details the requirements with which the product or the material used. 2. Manufacturing formula, processing, packaging, and testing instruction. 3. Procedures. 4. Protocol give instruction for performing. 5. Technical agreement are agreed between the contract givers. Report type. Number 1. Records provide evidence of various action. 2. Certificates of analysis provide summary of testing result. 3. Reports document the conduct of a particular exercise. Good documentation practices are 1. Handwritten entries should be made in clear. 2. Records should be made or completed at the time each action is taken and such way that all the significant activity concerning the manufacture of medicinal product traceable. 3. Any alteration made to the entry on the document should be signed and
The International Standard for Quality Management System ISO 9001 requires certain documentation, and so it's important when designing a quality management system document to focus on the efficiency and create processes and documents that are applicable in the organization. Here's to a classification, on other words, a representation to the usual hierarchy quality management system structure. At first, the quality management manual is dependent on the type of organization, and it's the description of quality policy and quality objectives of the company, as well as mission statements, process structures, and operational measures for their realization. The quality policy defines the quality objectives to which the organization strives, which means that it should state the commitment of the organization to quality and continual improvement. Usually, this policy is used for promotional purposes and should be displayed in the organization's premises and posted in websites so as clear and short quality policy is convenient in the general practice. Secondly, the process description or the quality procedures. They are the implementation of the principles and measures stated in the QM manual by process descriptions for core purposes and support processes. It's always including the title for identification of the procedure, the purpose so as to describe the rationale behind the procedure, the scope to explain which aspects will be covered and which will not be covered, responsibilities and authorities, records that can result from the activities, document control and description of activities. Description of the activities is the main section of the procedure. It relates to all other elements of the procedure and describe what should be done and whom, by whom and how, when and where, in some cases why should be clarified as well. Moreover, the procedure can have different formats and structures. They can be narrated or they can be illustrated. The third part to the classification consists of instructions and standard documents. Generally, they are the specification of measures, which are determined by the QM manual, and the process description by technical instructions and standard documents. The standard documents include formal documents, standard contracts to be used as required templates within the context of project management in order to guarantee the up-to-date status and the uniformity of the records. And so, controlling the document is important. Usually, the control of the QM documents include the drafting, amendment, verification, release, and archiving. And it can be classified into internal QM documents and external QM documents. Mainly, the internal QM documents include the person responsible for drafting, amendment, verification, release, and archiving. It's ensured that all documents are to be verified by persons who are not drafted these documents, and so each step is confirmed by central data processing system. Each QM document is checked regularly and updated if necessary. Modifications are only performed by the organizational unit that drafted the original document. The verified QM manual is released by the general management. Verified processes description, technical instructions, and standard documents are released by the key quality manager. On the other side, the external QM documents are defined as laws and ordinaries, official regulations, standards, guidelines, standards, and technical documents stipulated by the customer. At the very end, at last, records, and they provide a history of each batch of the product, including its distribution and also all the relevant circumstances relevant to the quality of the final product. Generally, it should show the name of the material on the delivery note and containers, the in-house name and or the code of the material, date of the receipt, supplier's name and manufacturer's name, manufacturer's batch or reference number, total quantity and number of containers received, the batch number assigned after receipt, any relevant comment. And those mainly are found in details in the records of batch processing records, batch packaging records, and the laboratory control records.
Advantage of documentation. Get a comprehensive and historical information. Information already exists. Does not interrupt program or client's routine in program. May bring up issues not noted by others. Inexpensive. Disadvantage of documentation. Often takes much time. Information may be incomplete. Need to be quite clear about what are looking for. Data is limited to what already exists. Information may be deorganized, unavailable, or out of date.
Specification of documentation. There should be authorized and dated specification for starting and packaging material and finished product. Specifications for starting and packaging materials. It should include a description of the material, which include the design name, the reference, the approved supplier, the specimen of printed materials, direction of sampling and testing, qualitative and quantitative requirement with acceptance limits, storage condition and precautions, the maximum period of storage before re-examination. Specification of intermediate and bulk product is similar to the specifications of starting material. Specification of the finished product should include the name of the product, the code, the formula, a description of the pharmaceutical form, package details, direction for sampling and testing, qualitative and quantitative requirement, the storage condition, the shelf life.